Good morning or good afternoon to everyone, depending on where you're calling in from, and welcome to Genetic Alliance's webinar series. My name is James O'Leary. I'm the Chief Innovation Officer with Genetic Alliance, and I'm happy to be here to moderate the call for Registry and BioBank question and answer session. Just as a reminder to all of our callers, you are muted during the phone call, and you can type questions in the comment box on the right-hand side of your screen. The topic of today's call is to really answer any questions that you might have on registries and biobanks with two experts that are joining us today. Those can be nuts and bolts questions. Those can be direction of the field, the perspective of kind of advocacy organizations in this space, really any questions that people might have. We will have two short, very short presentations at the beginning, but please type your questions in as soon as you have them, and we'll collate them on our end and then ask them of the speakers as soon as we get to the question and answer phase. So with that, I want to welcome our two speakers. With us, we have Liz Horn, who is Director of the Genetic Alliance BioBank, and Suzanne Vernon, who is the Scientific Director for Seafood Association of America. Thank you very much for joining us today on today's call, and I'll turn things over to Liz and Suzanne.
Thank you. Thank you, James. I want to thank everyone for attending our webinar today. My name is Liz Horn. I'm the Director of Genetic Alliance BioBank, and many of you know me. I'm a scientist by training, and I've been working with advocacy organizations for about the past 7 years in the biobanking space. And one of the things that I do on a day-to-day basis is I run our Genetic Alliance BioBank. And I'd like to introduce you to Suzanne Vernon, who is one of our member organizations. It's part of one of our member organizations for the biobank.
Hello, everyone. And as Liz indicated, I'm Suzanne Vernon, and I'm the Scientific Director for the Seafood Association of America. The Seafood Association is a small nonprofit organization that over the past 3 years has changed its strategic direction to supporting research. And prior to that, we were the largest nonprofit patient advocacy organization for chronic fatigue syndrome, or CFS, in the nation. So my responsibility as scientific director to the CFS organization now is identifying and supporting research throughout the world on CFS, as well as supporting creating and supporting a biobank, which is used as a resource for the research on CFS.
Great. So I think that before we start taking your questions, and I hope that they're coming in, the first thing I would like to do is I want to tell you a little bit about Genetic Alliance BioBank and some of the tools that Genetic Alliance is developing to help advocacy organizations navigate this space. So Genetic Alliance BioBank was formed in 2003, and it's a co-op model where we provide the infrastructure for registry and biobank systems to patient advocacy organizations. And if you could go to the next slide, please. We've developed a really unique model system where this can all be done remotely, either if advocacy organizations have an office or if people are spread out across the country. We have multiple web systems that allow member organizations to consent their participants, send them kits to collect blood samples or other kinds of samples, and then also to send them clinical questionnaires so they can fill out information about their condition. And then all of this is stored in a central biorepository and registry. And in our model, each member organization owns, governs, and stewards their own samples. But we set up this system that very easily any advocacy organization can use. And then one of the advantages is that they can concentrate on what's important to their community in recruiting their participants, setting up the studies appropriately to get the information that they need to move their research forward. And in addition to setting up this system, was also realized that we need to help educate the community at large about biobanks and registries because it can really be a daunting task. Next slide, please. So what we've done is at Genetic Alliance, we've created multiple resources. I want to tell you about our Registry and Biorepository Bulletin that comes out monthly. It talks about new interesting news in the field of biobanking, as well as training opportunities. You can see in this one we're advertising our webinar. And if you'd like to see the archived bulletins, they are at the website below, geneticalliance.org/biobanks.bulletin. And you can also sign up to receive them in your email. Next slide, please. The BioBank has its own website. And in our website, we have a tools and training tab that I wanted to let you know about. If you're not aware, but we have multiple different resources for people thinking about biobanking. We have a group called BioBank Ambassadors, which is a forum that connects organizations that are either establishing registries and biobanks or ones that are interested in doing so. We've run some training modules, such as our BioBank boot camp that we ran last January, and there are multiple materials that you can download to help start thinking about this. We have a listserv, and we have some archived videos and webinars. And we just had a webinar on August 11th last month where we had 2 organizations talking about making your organization's registry or biobank a reality. And with that, I think I'm going to check in with James to see if we have any questions, but please feel free to visit biobanks.org. James, do we have any questions?
Sure, we definitely do. Suzanne, did you want to say anything before we got started?
Yeah, actually, I would. I learned about the Genetic Alliance Biobank just about a year ago, and this is while I was at a public genomics continuing education course that I was taking up in New York. And we had not, at the CFIDS Association, yet established a biobank, but had been thinking about how to go about the process. So when I learned from one of the Genetic Alliance staff members about the Genetic Alliance Biobank infrastructure, I was absolutely amazed, because what Genetic Alliance Biobank has done is really done a lot of the footwork, the groundwork, the due diligence that is really required in order to establish a biobank infrastructure that is one that is a very reliable resource. And I think the Genetic Alliance Biobank has done something that very few, in fact, no others have in the biobank field have done, and that is set up a system where, as Liz showed in the slide, there is this sample collection process, the biological sample collection process that can occur. Really, it's set up to allow sample collection from people all over the world. So sample kits go out to people, and then the process is put in place for them to send them back to where the biorepository is so that they can be processed, handled, and processed appropriately. And at the same time, and perhaps one of the most important aspects of the biobank is the Genetic Alliance has partnered with GeneLogic, which has set up this absolutely beautiful database structure that allows a safe and secure, private information, depositing clinical and all of the patient information that is required, and links that to the biological samples. And this was what was very attractive to us as an organization, because this has actually been one of the major stumbling blocks when it comes to finding the various types of markers that are needed for diagnosis and treatment in CFS. The connecting of the important clinical and demographic information on patients with those high-quality types of samples. So again, I would like to emphasize that this Genetic Alliance Biobank infrastructure is unique, it's very powerful, and when members such as my organization, buy into the Genetic Alliance BioBank infrastructure, you get a lot for basically the cost of buying into this infrastructure. Then what's nice is you buy the infrastructure and then you can basically design in a very customized way your biobank. So that's what we have been working on for the past couple of months. And in the process of working on customizing our biobank, we've also started a number of studies. So this infrastructure allowed us to literally hit the ground running, collecting samples, collecting clinical information, and at the same time partnering with a number of investigators who are interested in using these types of samples to further their research.
Okay, excellent. Thank you so much, Suzanne. We have a number of great questions. Unless Liz or Suzanne, do you have anything further to add?
No, I think we should get started with the questions and see where the discussion takes us.
Great, excellent. So the first question that was asked is a very practical one, and it references the last BioBank webinar. One of the presenters during that webinar mentioned that there were really only 4 registry companies that they considered. And the question is, I'd like to know what those registry companies are. So what are the major registry companies that people consider for this type of work?
That's a good question. So I know that we did a landscape analysis. We at Genetic Alliance BioBank about a year ago, and this paper was actually published in Biopreservation and Biobanking this past month, or this past issue, where we did a survey to look for things that we thought would be important to advocacy organizations who were trying to build registries and biobanks. So things like, was it scalable? Could you customize it? And then did it meet the various, what we thought was important for standards in terms of control vocabulary and messaging, and then also some basic sample requirements and metrics, and then security and privacy issues as well. And we did a really big survey, and we only found a handful that met our needs. And I don't remember all of those lists I don't remember the names of all the companies, but they were listed in the paper. One thing that we really found when we did the landscape analysis is not everyone does everything. So you have companies that are really, really good at building registries, but they don't have the sample capabilities. And then there are a lot of places that have really good biorepositories, but not all biorepositories have the robust data infrastructure with them. So I think it's really important to know when you're talking to vendors what kinds of things do you need. And in our boot camp, we did a session on vendor assessment. So we have a lot of tools that you can use to help get to those questions. But I think one of the take-home messages is not everyone does everything. And then, which is okay, but I think for what you need, it's better if you don't have multiple vendors, and especially if the data and the biorepository don't talk to each other, it doesn't make a whole lot of sense to set it up that way. So I think that's really important that they're integrated. And then I think as an advocacy organization, you really have to think about what kinds of other things do you need for customer support and to do this. So if we look at CFIDs, for example, Suzanne is a brilliant scientist who has many years of experience. And so she knew exactly what she wanted and what she needed, but it took her a while to find someone that could provide that. And not every organization is going to have a staff scientist. So I think that if you need to look at what internal expertise you have, if you need to bring someone on to help you do this, and what you need from your different vendors. So I think it's not a very easy question to just answer to say that here's a list of vendors. I know there are other groups that have looked at other vendors that I'm sure would probably share who those vendors are. when you do talk to vendors, you end up signing non-disclosure agreements, so there are certain things they probably can't even tell you. But I do think that on the registry space, especially in light of the rare disease meeting that ORDR had in January, there were some vendors that sort of popped up saying, we could do this for rare diseases, but I'm not really sure that they have the right infrastructure and support to really help the community. So that was a very long answer to a short question, but I think it's an important question, and it's challenging. And I think that you have to just remember, if something does sound too good to be true, it probably is. And Suzanne, do you have anything to add to that?
Well, yeah, again, I would like to plug what you have worked so hard to create. I mean, you've done an incredible amount of due diligence for the Genetic Alliance Biobank, and so what you have created is close to one of a kind so far. And if you are a nonprofit organization looking for a very integrated, resourceful biobank, then you need to really think seriously about looking at what the Genetic Alliance Biobank infrastructure has to offer. Because as far as I have looked, as far and wide as I've looked for biobanks, again, the Genetic Alliance Biobank infrastructure is close to one of a kind.
Thank you. And I mean, I think we really do try to provide a service that is useful to our community. And since I'm the director, I don't really feel comfortable saying how great we are, but it is wonderful that one of our members thinks that. So I appreciate that, Suzanne.
You have to start saying how great you are, Liz, because you are. And very affordable, too. I think you should tell listeners or the attendees how much it costs to become a Genetic Alliance Biobank member.
Well, let's see where we are with some of the other questions, because I don't want to get too off track.
Sure. So first, one of the questions was, can we post a link to that paper? And absolutely, we can send out a link to all the attendees to the paper that Liz mentioned after the call.
Yes.
Great. So there are a couple more questions related to the discussion that's going on right now that I can kind of combine and list off really quickly. One is a question about whether the Genetic Alliance Biobank can be used in conjunction with an existing patient registry. And I think that can be expanded to a broader question as well, as if you have an existing patient registry, how do you handle that? How do you move to next steps for a biobank?
Well, I think one of the questions, so we have to think about what the systems are. So if, absolutely, if you already have, I like to call it legacy data. So you already have information about people in your community, and absolutely that could be moved into a new registry system. I think, at least with Genetic Alliance Biobank, we're not quite set up right now where it would make sense to maintain a separate registry and then use our biorepository, because they wouldn't talk. And so I think the real value is having the system where you know everything about the data as well as the samples. And then we also, at least within our model system, would have some challenges with our data mining software if all the data lived in another system. So I think there's no problem if the data already exists and we want to move the data into a new system, into sort of a new holding tank or new registry. And, data can always be moved. It's just figuring out the how and what it would take. So I think in that situation, definitely, but I don't think it would make sense to keep a completely separate standalone registry with the biobank, with our biobank model, because then it doesn't take advantage of all of the technical aspects of the system that we have.
Great. Excellent. So, there are a number of questions about the Genetic Alliance Biobank. I want to switch tacks really quickly, though. There was a question that came in around recruiting minorities, and what are some of the challenges, or what are some successful methods that you've used in expanding the recruitment for your biobank?
Yeah, I think that one's for you.
As far as recruiting participants or donors for our biobank, we have so far used a study design specific approach. In other words, if we have investigators that are interested in doing a specific study, then we identify the inclusion and exclusion criteria necessary to satisfy those study design requirements and recruit on that basis. And we've used a couple of approaches for recruitment. We've worked directly with clinicians right out of their office, providing either some support for staff and or the consent forms and bulk kits so that we can tap right into the various patient cohorts in these clinical settings. And we've also used our online media approaches to recruitment. In other words, we announce various types of studies and the inclusion and exclusion criteria to be a participant in that study, and then people contact our biobank coordinator directly. So actually, we've had great success using both approaches. And in the 6 months that our biobank has been up and operational, we've enrolled more than 500 people in our biobank. And we have also established partnerships with other organizations that are helping us recruit the normal or healthy controls, which is also a very important aspect for all of these, for anyone interested in biobanking. In order to really study any of these areas, you also have to have the appropriate types of controls for your studies. So in our case, we have participants who've enrolled in our biobank that are friends or families or regional people identified in that specific region that have agreed to be a biobank donor, and also, again, working with some other organizations that are working to help us stock, essentially, our biobank with healthy control participants. So we haven't had a problem finding people that meet the various study requirements, consenting them, and getting their participation. It's really interesting because a lot of people want to have the opportunity to participate in research.
Great, excellent, Suzanne. Oh, there's a question on here that relates to this, I think. How successful are organizations in getting their members to donate samples? Specifically, what is the percentage of positive response?
When we've opened it up, we have been inundated with positive responses or willingness to participate or become a biobank donor. So we have not found it to be a problem. I mean, again, I think the important point here is that patients really want the opportunity to participate in research. And the Genetic Alliance Biobank structure and designed for patient advocacy groups or nonprofit organizations such as the CFIS Association to participate in research gives the patient community the opportunity to do so.
Well, and I think that what we're really able to take advantage of is the patient advocacy organization already has a community of trust with its members. So when the advocacy organization goes to their community and talks about, we have a research study, would you be interested in finding out some more information, and they go through the informed consent process, there's already a relationship and there's already trust that I think isn't automatic. It has to be earned in other situations. And here, that trust has already been earned. And I know that when I developed the biobank for the National Psoriasis Foundation, we had a pretty strict inclusion and exclusion criteria because psoriasis is a pretty common disease. We were only looking for 1,000 samples, and probably about 5 million in the U.S. have this condition. And we had overwhelming support, and we really couldn't take everybody because they didn't meet the criteria for the specific study we were doing. And all of our groups have not had any problem recruiting participants. And some of our groups also take anyone who has a condition, which I think might be more common if there's a smaller population. Our groups are recruiting internationally, and I think it's just the trust is already there because the individuals already have the relationship with the advocacy organization. So I think I can't give you a percentage number, but excuse me, I think that's one of the main reasons why we see such great response.
That's a really good point, Liz, and I think another point to make is again, to emphasize this cooperative model. So, for example, we ran into a situation with a particular study where we needed a particular type of control, healthy control for a study, and what Liz enabled me to do was to contact the other members to query them to see if they had those particular types of subjects and or samples that met our criteria. So this cooperative model really does, in essence, provide for a centralized repository in many ways that gives you access not only to your specific disease area, but to other disease areas as well as the possibility of healthy controls. So it's a very, very powerful model.
Excellent. Thank you very much. Another question that we got is, are there any technical advances recently that are making it possible to put tissues or material in biobanks that weren't possible to store previously?
Liz, do you want to handle that, or you want me to?
Well, I think we both should. So I think that one of the really exciting things is that the biobanking field is very active and very vibrant. And Suzanne and I were both at a meeting, the International Biobanking Professional Society, and lots of vendors were talking about their new advances. I was just at a meeting recently where people were talking about, being able to store smaller and smaller materials and being able to use different storage conditions. So when things might be able to be stored at room temperature instead of in a traditional freezer environment. So I think that there are advances all of the time, but I think with anything, when something new comes out, it's sort of how do we get adoption from the greater community, because this is how we've always done it, and we know this works. And this happens in science all the time when a new technique comes out. And so I think we are seeing some new advances, and then just trying to, I think the community is just trying to figure out what should be adopted as a whole. But I think it's an area of a lot of activity, and I think that's very exciting for the field. Suzanne, do you want to talk more about that?
Yeah, I do. I think some of these new advances are, in fact, very exciting. We heard about one approach, where they can desiccate DNA to the point where it lasts forever. And I think we have to remember that it's important to put the biological sample in the context of what the question is or questions are that we're trying to answer. So DNA may be good for genetics, but it's not necessarily going to be good for understanding some physiologic perturbations that might be going on in a disease, or for particular types of pathogen discovery or other types of biomarkers. So when you are putting your biobank together, it's important to remain open to the fact that various studies or various investigators are going to require different types of samples from your biobank donors or participants. So you need to be open, and you need to really required, I think, to conduct robust and reliable, reproducible science that's going to get us further in identifying biomarkers that are important for these various diseases.
Okay, excellent. At this point, there are a lot of questions about the Genetic Alliance BioBank. So perhaps I can just ask some rapid-fire questions of both Liz and Suzanne, and we can get through a bunch of these. There are about eight of them.
Sure.
Oh, go ahead.
Oh, and I just wanted to point out that for people that are interested in the Genetic Alliance BioBank, we did 2 webinars specifically on them that are on that website, and also in the Genetic Alliance research repository. So there's a tour of the software, so you can watch that, and then as well as some of the infrastructure overview pieces. But yes, let's do rapid fire.
And that answered one of the questions right there. And as a reminder to folks, that's resourcerepository.org. And I imagine if you just type in BioBank, that will come up. You can also see an archive of old webinars on Genetic Alliance's website at geneticalliance.org/webinars. So first and foremost, then, there are 2 questions about cost. Liz, and I'm not sure if you can answer these on the phone, which is, what is the cost of becoming a member of Genetic Alliance's BioBank? And then more specifically, what is the cost per sample per year to use the Genetic Alliance infrastructure?
So we have, so whoever had this question, please contact me outside of the webinar, because this ends up being very customized for each individual. But basically what happens is we have a $20,000 fee to be part of Genetic Alliance BioBank, and that gets you access to all of the software. There is a $20,000 joining fee in the first year that really helps cover the tools and the training, and there's a lot of one-on-one mentoring with me, and to really help get you ready to be running your own research studies. And after that $20,000, everything else is per sample. So we have price points for kits and DNA isolation, and so we'd have to look at what you wanted to do, and everything's a la carte. So if you ordered 10 kits, it would be 10 times what it would be if you didn't order any kits. And the more active you are, the higher your biorepository cost would be. But we could definitely talk about that offline. But again, it's going to differ for each organization depending on the kinds of things you want to collect.
Okay, excellent. Along those same lines, what is the range of types of both clinical information and samples that members of the Genetic Alliance BioBanks collect?
So a lot of people collect DNA, but and I think some of the groups that have been around for a longer period of time, they started with DNA, and now we're getting much more into functional studies. Suzanne's group is doing a lot more with cells, with plasma to look at biomarkers. And we have a lot of good vendors, and we also do tissue, and we can really do any sample that you need. And the way our system works is we start going to our vendors to find out, can they do what you need? And if they can't, we find a vendor that will. And Suzanne can probably speak to this a little bit, because we really had to customize what we needed to do to meet CFID's needs, because it was something different than what anyone else was doing. And James, there was another part to that question that I think I missed.
And then also clinical information. And the question specifically, let me see if I can find it on here again, is clinical information collected likely varies depending on the condition? Is this determined by the particular disease condition advocacy group? If so, presumably the database is flexible to accommodate that?
Yeah, it's completely customizable. So everyone's questions are really different. There are some basic demographic questions that are shared, and then maybe some general disease questions that are shared, but it's very, very different depending on the group. And like in Suzanne's case, they have a lot of questions on triggers and health assessments and medication usage and history that are very specific for chronic fatigue syndrome. So it can be completely customized for what you need, and most groups design it working with their scientific advisory board or a group of experts to help them figure out what questions need to be asked. And that's really part of part. Once you know what you want to ask, getting it programmed into the system, that's easy. But to figure out what is important and what do you really need to, what information do you need to help researchers and to help build a greater understanding of the condition you're studying, that's what's hard, and that's really what takes, I think, the most time. And I just can't stress that enough. And once you figure that out, then it becomes very straightforward. You just program it.
I would like to add that the way that we designed our clinical questionnaire was to be very comprehensive, number one, and also to collect information that has been collected in large population-based surveys so that we can relate our findings, our data, back to population norms, and also try to incorporate standardized and validated instruments into our questionnaire. So, for example, using demographic questions that are used in the National Health and Nutrition Evaluation Survey, that's a CDC population-based survey, and also questionnaires like the SF36, using the generic RAND 36 form. So these are, our design was to not only collect CFS-specific information, but to collect very general health and wellness information in order to be able to relate that back to population norm data. And again, this, because we're a member, this type of database information is available then to anyone else that joins in, or current members that want to tap into it.
Excellent. Along those same lines, speaking of structured data and standards, one of our questions is, how will the SNOMED CT map to rare diseases? And I guess this will be to the clinical information as well.
Yeah, I mean, I think it actually, so we just did a mapping with Joubert syndrome, and it actually mapped pretty well, but then there were some related disorders that we weren't able to map. And so I think that SNOMED does a pretty good job, but when you get something that's very, very rare, sometimes it's just not in the vocabulary. But I think the one advantage with SNOMED is a lot of people use it. So if people are all mapping to the same standard, it's going to be easier to combine those data elements when you want to look at multiple data sets together.
Okay, excellent. Another question was, PXC requests its members to provide tissue samples from operations, etc. Does the biobank provide services for storage and distribution of those materials?
Yes. Yeah, absolutely. I think with tissue, the biggest challenge is actually the acquisition, getting the tissue, and we have some new groups that are going to be very active in tissue collection, so I expect we'll be getting some better protocols for actually obtaining the tissue, but yeah, we can absolutely store and distribute it.
Okay, great. And one more Genetic Alliance Biobank question, and then we're going to switch back to more general questions. If we just want a registry for the foreseeable future, is the Genetic Alliance Biobank an appropriate solution?
So we don't have a registry-only option right now, and I think from a cost perspective, I don't think it would make a lot of sense to go with us just for the registry. The way we're set up is the groups need to use, in the contract, the member groups need to use Genetic Alliance vendors. So you could join us with the idea of collecting samples in the future, or possibly wanting to collect samples, but you would have to use our biorepository. So I think if you're really unsure about the direction you want to go with the biorepository, it probably doesn't make sense to be part of us at this time because we don't have a registry-only option. We are looking at that, but we've not been able to figure out an appropriate model for it. So stay tuned, and hopefully we might be able to come up with something in the next year or so.
And I would like to add that because we are happy with the biorepository part of the Genetic Alliance Biobank, we have kind of a general enrollment part of our biobank where we identify patients in the community who want to be part of research. And we essentially only enroll them and acquire their clinical aspects. So we have both a registry component with the understanding that we will be using the biorepository component if needed to our biobank.
Right, and that's a really good point, Suzanne. A lot of groups aren't collecting samples on every single person, and that's fine. And there are no minimums on sample collection in our model system. So it is flexible, but I think for people that are having these really specific questions, set up some time to talk with me offline, and then we can really drill down and see what makes sense or what doesn't make sense.
Great. Thank you very much. To switch now back to some more general questions about biobanking, one of the questions was, what privacy protections are in place to ensure individually identified samples are protected?
So that is that's a very good question, and we have, so on our website, on the About tab under biobank.org, there's a lot of really specific information about privacy and security. What we've done is we train our member organization in terms of informed consent and how to keep the information private and to protect the individuals. We're also, so sort of how they're doing their own storage of the consent forms and those kinds of things, and how to keep things separate within their advocacy databases. We're also working with GeneLogic, who is a vendor that has a lot of built-in privacy and security pieces in place within their systems. And they do a lot of work for pharma and clinical trials, so they are meeting all the required standards for the FDA, which I think is important, because any of these studies that you're doing, if you ever then want to use it later on, you need to make sure it meets the regulatory approvals. So I probably need to get back to you on the specifics of what the systems are in place, but we definitely have robust systems. Suzanne, do you want to add anything to that?
Only to say that, you know, the coordinators of the individual biobanks are really the only ones that have the identifiable information. And as Liz said, once the sample becomes part of the biobank, it has barcodes and unique identifiers that this is the only thing that other people in the biobank and also the applicants that apply to get the information of the samples from the biobanks have access to. So it does meet the requirements for most of the or all of the ethic requirements for privacy and security that we've run into so far.
And is there a range among different biobanks and registries? Are there standards in the field that are well agreed upon for privacy protections?
I don't know. I mean, I know we have HIPAA, and I know that that there are applicable state and federal privacy and security laws. But beyond that, I'm not sure if there are specific privacy requirements.
I think it's a constantly evolving field, and the rare disease community provides a very challenging area when it comes to privacy and security. If you're dealing with a disease that occurs in 100 people throughout the world, it becomes a real challenge to maintain that type of privacy and security, especially when it comes to dealing with very rare instances. It's less of an issue, I think, even though there are still are not standards for more common chronic illnesses. You have larger numbers, so it becomes less likely to be able to identify any one individual when you have thousands or tens of thousands of people compared to literally tens or hundreds. But it's definitely evolving.
Okay. This is a similar question, actually, in that it has certainly privacy implications. The question is, are there tools that let patients participate in the management of genome access? And I assume that means related specifically to biobanks and DNA collection.
Well, I mean, there are, and if many of you have been to our conference, you might have heard Private Access give a presentation. And in their model system, it's really the participants that decide who has access to the samples. But right now, we don't have anything like that within Genetic Alliance Biobank. James, you're really knowledgeable about this area. Do you want to add anything?
Certainly. So the question, I guess, could be towards two areas. One is letting the patient see information about their genome, and certainly there are some kind of direct-to-consumer companies that do that give different types of information, like 23andMe, if it's specific genetic tests, groups like DNA Direct or Navigenics. If it's more on controlling who sees access to your genomics, yeah, I think you're right along the lines of a group like Private Access. But overall, there's not a lot of control on the patient side as to who sees this information. There's kind of standard laws for transfer of that information, but not a lot of control on the patient end.
And I think the one thing, if you are part of an advocacy initiated or an advocacy-run biobank, that advocacy organization, they're going to have a committee that reviews all research applications for access to samples, and that group is going to make sure anyone that gets samples, and all these samples would be de-identified, but anyone that gets samples is going to, has a legitimate research project. And I think that, in that way, the advocacy organization and their sample use committee is going to be really working on the community's behalf to make sure appropriate people are using their samples.
Great, and that is certainly a question. One of the questions was about ethical questions. I think one of the big questions in the field is, now that we've moved to this idea of community or advocacy organization controlled biological sample repositories and registries, it's a new governance model. It's also a new model of review and kind of control of patient communities. But there is still the question then, as technology develops, of is it the individual that should control their involvement in research, or should the organization, community-based or disease-specific organization, be a steward of that information, kind of as a knowledgeable intermediary? And I definitely think that that is a question that all of us are asking ourselves: what are the best models out there?
Well, and also it's been really high profile in the news lately with there were two examples recently in the past month where people thought that tumor tissue was frozen for them at time of surgery so they could possibly use it later for a vaccine study. I mean, these both happened at, I think they both happened at Thomas Jefferson University in Philadelphia. But basically they didn't have a mechanism to do that, so it wasn't done, and the participants or the people were really disappointed because they thought this sample was available and it was never frozen. And so the individuals weren't able to be part of the study. And so that's getting a lot of high-profile coverage. And I think the big question is who ultimately owns the sample. And when you sign a consent form, very often you are signing over your rights to the sample to whoever is asking you to sign the consent form. And I know in our model system, in in the Genetic Alliance Biobank, if people want their samples destroyed, they can be destroyed, or if they want them transferred somewhere else, we can do that as well. But not all biobanks are set up in a way that for that to happen. So I think this is going to continue to have more discussion, and as well as I expect court rulings on who owns biological samples.
I think it's also important to emphasize that the biobanks are designed mostly for research purposes. And oftentimes, since research is exploratory, it is not yet ready for prime time or changing the current standard of care. And so we have to really keep the current standard of care in mind, with, of course, the goal of improving that standard of care by doing specific types of research. Another important aspect of the biobank is that even though the individual members are the only ones that have the communication to the various donors, if an investigator who is conducting research on donor samples finds something that's important, then what these investigators can do is contact the individual biobanks, and then the biobank coordinator can contact the various subjects and get their permission or not to see if they're interested in working directly with that investigator. So that's one way of kind of getting permission and ensuring kind of the privacy and security of that information, but yet allowing the individual to actually participate directly in a finding that may impact that standard of care directly.
A similar question that was asked that touches on some of these similar issues is, has there been any discussion with CDC to utilize this biobank as a means of providing specimens needed from patients affected with conditions screened by newborn screening programs or carriers for a condition for the CDC proficiency testing program? Seems like this might be a way to accomplish it while maintaining anonymity of donors.
That's a great question, and I know that Sharon Terry, the president of Genetic Alliance, has had discussions with CDC, and I'm just not sure if they've been directly related to this, but that's a good suggestion, and we will share it with Sharon.
Excellent. And yeah, I know that those types of questions around banking of newborn blood spots are certainly some of the ethical, legal, social issues that go up in these areas, especially since, registries and biobanks are not all of the same type. There's registries for tracking purposes, there's registries for research purposes. There really are all the different types of registries. There have been two questions on a similar topic. One is essentially, what funding sources would you suggest for individuals who would like to start a biobank? And the other question is, how do you, the people on the call, fund your biobank?
Suzanne?
So we are currently we started the funding of our biobank through donor support. And as we've gotten up and running, we actually, we charge investigators in order to access the samples that we collect. So it becomes a cost-sustainable model. So we tack on to the cost that we charge investigators our costs, not only our direct and our indirect costs to sustain it. We've also applied for various grants to support our biobank infrastructure further, and we're still working with those. But right now, most of our money comes from investigators essentially purchasing the samples and our donors to our organization, our membership.
And I would say that's very similar to the other biobank member organizations as well.
It's not easy because I have been told that many of the federal agencies, since they have their own biobanks, aren't necessarily interested in supporting or providing funding for these types of biobanks. So I think members have to come up with donor support as well as other creative ways to make their biobanks sustainable.
And I think from an organizational perspective, I really think that this has to be a priority for the organization. I mean, biobanks are expensive. I know that within our model we are really, really able to shave costs, but these aren't trivial costs to an organization, and I think that it's essential that the leadership, the board, and the community is behind it. And usually the community is really excited about something like this because it's a really tangible research action that they can be involved in, but also really has the potential to help research and then eventually help the standard of care. So I think it's very easy. It's quite easy to get them motivated, but if your leadership and your community isn't behind this, you won't be successful.
And I think the point about your membership and your organization really has to understand the need of the biobank. In our case, it was clear that there was a need for such a biobank because we have investigators and clinicians all over the world, each using different methods of collecting clinical information, different methods for testing various samples. So and our role was to really provide a centralized and standardized resource for clinical information and biological samples back to the research community.
Okay, thank you very much. At this point, we're kind of out of time. We answered almost all of the questions, but if you do have additional questions, I'm sure our speakers would be happy to answer them. I know that Liz, her information is on the Genetic Alliance Biobank website, biobank.org, as well as geneticalliance.org. It's lhorn@geneticalliance.org. If you are interested in this topic, you'll probably also be interested in an upcoming webinar we have on October 27th on biobank governance. You can sign up for that webinar in the usual place on geneticalliance.org/webinars. And information will be up about that soon. In addition, as a reminder to participants, we did record today's session, and we will either post the recording or a frequently asked questions document for people in the next few weeks. And we do that for all of our webinars, so please visit our website too to read slides from old webinars and also to view recordings of those sessions. So I really want to take this time to thank both of our speakers who have been excellent, answered a huge number of questions on today's call, and certainly to thank our participants for asking so many good questions. Suzanne or Liz, is there anything you'd like to finish up with?
Liz, if anyone wants to contact me, please, I would be happy to provide them with any further information, so you can give them my email address if they contact you.
Perfect, and I just want to thank everyone for attending, and I think it's really important that we keep the conversation going about biobanks and registries because they're really, really valuable tools and resources, and they are challenging. And I'm so excited everyone showed up today, and I look forward to continuing the conversation. And please don't hesitate to contact me if you have additional questions or if you would like to learn more about Genetic Alliance Biobank. And I'd really like to thank James for being an excellent moderator.
My pleasure. Thank you all for joining us, and we hope to hear from you again soon. Thanks.
Thank you, everyone.
Have a good day.